Hi friends, today I will discuss about clinical features of Menieres disease. Already in previous lecture I discussed about pathology, etiology and definition of Menieres disease. Please go to that video and see that video. After that, see this video, you can understand better. I will start now. The Menieres disease occurrence of age is 35 to 60 years. Sex, males are common than females. Disease is unilateral, but other ear may affected after a few years. That means in acute Meniere's disease, only one ear is affected. In later stages, that means in chronic stage, the other ear also affect. Means at the onset, the disease is unilateral. After that, it spread to other ear. That means it can other ear it converted into bilateral. What are the cardinal symptoms? Cardinal symptoms means main. The disease conformably associated with that symptom. That main symptoms are called cardinal symptoms. They are episodic vertigo and fluctuating hearing loss, tinnitus, oral fullness. Episodic vertigo means the person feeling that surrounding environment is rotating, or the patient feeling that he is rotating himself. Or episodic vertigo means the vertigo presents the episode of Meniere's disease, that is called episodic vertigo. Fluctuating hearing loss. Fluctuating hearing loss means it is varying in intensity. Tinnitus. Tinnitus is a ringing sound in the ear. Oral fullness. That means the person feeling that fullness in the ear. It is physiologically feeling during swallowing and anning process, but abnormally feeling in Meniere's disease. First, I will discuss about the vertigo, how it will be in the Meniere's disease, how it will be presented during the Meniere's disease. Sudden onset, to and fro, up and down. You feeling that you moving to and fro, that means front and back, up and down. You feeling that you going up, you coming down. You feeling that. Normally, it is accompanied by nausea, vomiting with the ataxia and nystagmus. Normally, the vertigo is associated with nausea and vomiting. Along with that, in the Meniere's disease, along with the nausea and vomiting, ataxia, nystagmus also present. Severe attack, the vagal disturbances also can see. That is abdominal cramps, diarrhea, cold sweats, pallor, bradycardia. Abdominal cramps, diarrhea, cold sweats, pallor, bradycardia. These are you can see during severe attack. Tullio phenomenon. What is Tullio phenomenon? Normally, tinnitus means ringing sound in the ear. In the Tullio phenomenon, loud sounds or noise produce vertigo. That means if we speak loud in front of the Meniere's disease, he can undergo vertigo. That means he feeling that the surroundings rotating or he rotating himself. That feeling he felt during when we speak loud in front of Menieres disease. This is happen when we speak loud in front of the Menieres disease. The mechanism of Tulle phenomenon is normally Menieres disease is accumulation of endolymph. That means in the membranous labyrinth there is accumulation of the endolymph. Cycle and reticle also membranous labyrinth. If there is accumulation, the cycle also distance. Normally cycle is lying against the foot plate of stapes. During distended cycle present distended in the during Menieres disease, you can see the distended cycle. When the loud sounds are coming from the environment, these pass through the oscular chain through the foot plate of stapes. It irritates the distended cycle. Why? Because it lie near the foot plate of stapes during distended. When it irritated, false impulse is going through the membranous labyrinth. It leads to producing vertigo. This is the mechanism how the Tulle phenomena occur. I will give one example. If Menieres patient will go near to the temple. Why? Because the temples are the centers for sound pollution. Already we know that. Why? Because they kept big mics and mic set near the temple. So if the Menieres patient go to the near temples, he can confirmly get vertigo. Why? Because there is definitely there is high sounds near the temples. If he go to the temples, he can fall down. Our members what think that he had something bad thing, so he come to the temple, he fell down. Our people think like that. They don't know that is disease. That is Tulle phenomenon. This is the mechanism how the distant cycle lie against the foot place. Hearing loss. How the hearing loss will be present in the Menieres. Now I will explain. It is associated with vertigo or may precede it. Hearing improves after the attack. That means at the time of attack of Menieres disease, hearing loss will be present. After the attack, hearing will be improved as normal. Fluctuating is the characteristic. Now only I told that. Distortion of sound due to diplopia. You can see that diplopia. What is mean diplopia? Diplopia means double vision. Same like that only. Diplocusis means double sound. If you imagine that same sound coming from the cell, you think that this sound produce one type of pitch in the affected ear and one type of the pitch in the unaffected ear. This produces the dip accuses. This dip accuses is the characteristic of the Menieres disease. Intolerance to loud sound. Now only told no, it is he can not bearable the loud sounds. Tinnitus, ringing sound in the ear. It is aggravated during the attacks. It is a hissing character. Oral fullness. It is also fluctuates. Now only told that what is meant by oral fullness. Oral fullness is a fullness feeling of the fullness in the ear. Other features are emotional stress. Emotional stress also can lead to the Menieres disease. This is why if you take history correctly from the patient, you can definitely goes towards the diagnosis. You can diagnose probably or definitely. Now, types of Menieres disease. This is cochlear hydrops. That means there is caused the obstruction at the level of ductus venus where it is present. Ductus venus is present the point where the cochlear duct meeting the sacral ventricle. That point is ductus reunions. If the obstruction is present at that point, the cochlear hydrops is produced. If the cochlear hydrops is present, the cochlear symptoms along with oral pressure is the patient is came with cochlear symptoms and oral pressure. What are the cochlear symptoms? Hearing loss will be present along with oral fullness or oral pressure. Vestibular hydrops. Vestibular symptoms. What are the vestibular symptoms? What is the function of vestibular apparatus? The function of the vestibular apparatus is equilibrium and balance. That means the equilibrium and balance are disturbed during vestibular hydrops along with oral fullness or oral pressure. Tuberculosis otolithic crisis. It is also called as utricular Menieres disease. It is sudden drop attack without loss of consciousness. Please remember that it is without loss of consciousness. There is no loss of consciousness, but attack will be present. What attack? Menieres disease attack. How it will be present? It will be present with vertigo, sensory neural. That means hearing loss, oral fullness. These are the classical symptoms. Tinnitus also present. Feeling of poleaxed. Poleaxed means if you imagine that somebody following you along with axes in their hands come and beat you and they pull you on the ground and they are trying to kill you. This is the poleaxed. Axe means goddali. Poleaxed means full on the ground and they try to kill them. The tuberculosis otolithic crisis, that means utricular Menieres disease. The patient with utricular Menieres disease, that patient is feeling that poleaxed, the feeling of poleaxed. It is really bearable. The the patients with utricular Menieres, they're really horrible. Why? Because they feeling always like that. No, somebody coming, somebody killing me. We are very scared if like that patients are behind us. It is causes disturbances in the sacral and ventricle. Larmoyes syndrome. What is meant by Larmoyes syndrome? It is the one type of the Menieres disease. Symptoms are seen in reverse order. Normally, the order of symptoms in the Menieres disease is first vertigo, after that hearing loss. But in this type of Menieres disease, the symptoms are reverse order. How it will be present? I will tell now. First, hearing loss will be, later vertigo. At the time of presenting vertigo, the hearing will be improved at the time of vertigo. This is the characteristic of the Larmoyes syndrome. Now we will go to the Menieres syndrome. What is Menieres syndrome? It is also called as secondary Menieres disease. And why? Because it is secondary to other causes. For example, trauma, that means head injury during road traffic accidents, viral infections, syphilis, Cogan syndrome. These are the diseases associated with Menieres disease. This totally called as Menieres syndrome. Diagnosis is very very important. Please listen carefully. Why? Because always we are confusing with vertigo with Menieres disease. That's why you can listen carefully. Symptoms for the diagnosis criteria are spontaneous vertigo, hearing loss, tinnitus or oral fullness, other causes. In possible diagnosis, episodic vertigo. Vertigo is present, but it is without documented hearing loss. Without documented, please remember. And hearing loss, it is fluctuations are present, and fixed sensory neural loss are without definitive episodes. There is no definitive episode, but there is fluctuating and fixed sensory loss, but without definitive episodes. Tinnitus is not present, other causes are excluded. In probable diagnosis, one vertigo episode of greater than 20 minutes duration, one only, audiometrically documented at one occasion. Hearing loss is audiometrically documented. Audiometry means it is a process to detect the hearing loss. Present, what are the present? Tinnitus and oral fullness are present, other causes are excluded. Then it is probable. Definite, greater than 2 vertigo episodes of greater than 20 minutes. In 20 minutes duration only you can see the more than 2 vertigo episodes. Hearing loss is audiometrically documented, and oral fullness or tinnitus are present, other causes are excluded. Certain diagnosis of Menieres disease is definite Menieres disease with histopathological diagnosis of the Menieres disease. This is about the diagnosis. Thank you for patient listening.